Hello, my name is Delo, and today we are going to do an arterial blood gas test. So we need to evaluate the patient's needs for this procedure. So we are looking for signs such as cyanosis, shortness of breath, or any accessory muscle use, or anything that will indicate that the patient's respiratory has some problems. And it will also kind of help us diagnose or get some diagnostics on the patient. So after that, I would check the patient's chart, make sure I see the vital signs for trending, any anticoagulation or anticoagulant therapy, the patient's FiO2, any oxygenation device, like what kind of oxygenation device the patient is on, negative modified Allen's test, and if the patient has some graphings on his arterial or any shunting, that will be like some of the contraindications that we can't do this test on this patient. So once we get all the information and we know all the contraindications, we are going to grab our equipment. So we need a pair of gloves, size smaller than what we usually wear, an ABG kit. So in this kit, we need to make sure that we have the requisition slip, a heparinized syringe, a needle with a cap, biohazard bag, iodine, band-aid, alcohol prep pad, a cap for later purposes, and a gauze. We also need to make sure that we have an eye slash just in case we can't run it within 15 minutes, and a towel just in case we can find the radial or in a place where we need to do or we're going to do the procedure. So once we have all the equipment, I'm going to fill out the requisition slip, make sure that I have the patient's name, patient's temperature, FiO2, the time that I did the arterial blood gas test, and the room number. So after filling the requisition slip, I'm going to wash my hands, knock on the patient's room, enter and introduce myself to the patient or to the family member. So hello, my name is Delo. I am from the respiratory department and I'm here to do an ABG test. And then I would ask the patient to state his or her name and date of birth. And I would also check the wristband. I would also check for the medical number, scan it, make sure that it's the right patient. After that, I would explain to the patient and to the family member what this test is for. So we are doing an ABG test, and this is just basically going to tell us or let us know how well your lungs is functioning, and it will also let us help you or help us modify a care plan for you. So once I've explained that, I would explain the risks. So some of the risks in this invasive procedure is we could introduce a bacteria into your system, hemorrhage, or skin problems could also be one. So any of those could be risks. So once I've explained those, I would ask the patient or the family member if they have any questions. And if they don't have any questions, I would go ahead and start the procedure. So I would start the procedure by looking at the patient's chart, making sure that the patient is stabilized in an oxygen level for at least 30 minutes. After that, I would reposition the patient's hand into a comfortable level or position for my working. I would put on my gloves. So while doing this, I would talk to the patient because sometimes it gets boring. gloved up, and I'm going to position the patient's arms. I'm going to set up my equipment. Since I'm a lefty, I'm putting everything on my left. I would ask the patient if I could place this into his or her arms. There we go. And sometimes, since this is a new syringe, sometimes when you take this off, the needle comes with it. So I'm just gonna do a little fixing. And be careful with recapping this because it's a needle. You don't want to poke yourself with it. There you go. Make sure the bevel is away from this cap. That way when we do the procedure, there's no hassle. So we also want to put the pull an air inside to all the way to 1 mils because we need 1 mils for this procedure. So once I've done that, I would check for the site that I wanted to do the test. So we have 3 sites that we could do it to. We have the radial, which has a 45 degree angle, a brachial that has 60-degree angle, and then femoral that has a 90-degree angle. So at this point, I would do it on the easiest one, and it has less complications, which is the radial. So once I know where I'm going to do my puncture, I'm going to do the modified Allen's test. So how we do it is we occlude the radial and the ulnar artery, and we would ask the patient if he or she could pump his fist while we occlude it. So once we see a discoloration, so no pink color and it's turning white, we would let go of the ulnar, and we would ask the patient to stop pumping, and we would want to see a coloration back into the hands. And if it fails to do that, we would go on the other arm because this arm failed the modified Allen's test. So we would go on the other arm for that procedure. So another modified Allen test that we could do for unconscious patients is we could occlude again the radial and ulnar and start kind of pushing back the blood, kind of doing it for them. And then once we see discoloration, we could let go of the ulnar and see if there's any blood return on the hand. And if there is color coming back into the hands, we could go ahead and do the procedure. So at this point, this patient passed the modified Allen's test, so I could do my my ABG testing. So I would feel for the radial pulse, and once I feel the radial pulse, I would go ahead and start with the procedure. So I'll take this out, and this is a technique that I saw in one of the clinical sites that I went to. It's an easy access for them for later on. So I would feel for that. So once I feel it, I'm going to clean it with an iodine. Clean the site, circular motion, alcohol, circular motion, and let it dry. Make sure that the alcohol is completely dry because it could be more painful for the patient because there's alcohol in it when you puncture them. So once it's all dry, I'm going to feel again where I'm going to poke the patient. So I'm going to feel for the strongest pulse. Once I feel it, I'm going to sorry, a little commercial again. Okay. going to, there we go. I'm going to uncap it. Feel again. Make sure you can see the bevel. Okay, once you feel it, you could advance the bevel. Feel it again, make sure that you're in the right place. If not, you could reposition. Once you know that you're in the right place, you could advance. So you could see that there's a blood return. So if it's fast like that, you know that it's an arterial. Okay, once it's filled, you could place the gauze in here, apply pressure. Cap, make sure that you don't poke anybody. Take this out, take the sharp out, place the cap. Make sure that you tap it once or twice. Make sure that there's no air bubble in here, and then press up. Make sure that there's no air bubble in there, and start doing the 8 motion. Make sure that you don't touch where the blood is, because our body heat could interact with the blood and could cause something in the blood. So while doing this, once I'm done doing this, I could put the requisition slip in here and put it in the biohazard bag. And then while we're doing this, we do this because we want to stop the bleeding. So we apply pressure. So it usually goes for about 5 minutes, but if the patient is in an anticoagulant therapy, it goes to almost 10 minutes. So once there's no more, once you can see any blood coming out, once it's all dried out, we could put the bandage on it. And then now that this is on the biohazard bag, I could toss everything away. Toss this in the sharps container. Take off my gloves. Wash my hands. And then make sure that I run this into the lab. If I can't run this within 15 minutes, I would put this on the ice slush to prevent any clotting or things like that. And then I need to make sure that I run this within the hour, because if not, then I have to take another blood sample from the patient. And if I'm going to run this within the 15-minute range, I will go into the lab and then put the blood into the analyzer, let the analyzer do its job, and then once the analyzer have printed out the information, we could I would interpret it, and then I would create a modified care plan for the patient. And once I've done that, I will call the physician and let the physician know the interpretation of my interpretation, and then the results that the patient got from the ABG test. And I would also tell the physician the care plan that I have modified for the specific patient. After that, after talking to the physician, I would chart, and then after charting, I am done. So I'm done with the procedure. So three non-invasive alternatives for this test is a transcutaneous blood gas monitor, a capnography, and pulse oximeter. And then some reasons for the variations of sample size is if the analyzer needs more blood, we would get more blood from the patient, or if the nurse and the physician needs more blood for testing, we would get samples. And then um, so if we have an excess of heparin in the blood into this thing, it could increase the um, pH and decrease the CO2, just not kind of like not good for this test, and it could be a bit more diluted. So some complications for this test, since it's an invasive, we could put bacteria, as I said earlier. There could be vasospasms, some hemorrhage, damage to the vessels, and lastly, I could either get a venous sample from it. And then we also would want the patient to be at least 30 minutes in a stable oxygenation before we do this test, because they need to have that that level of proper oxygenation before to get a good reading of the ABG test. So thank you for watching. Did I do good?